Ignaz Semmelweis was a Hungarian physician and scientist born in 1818. He is known today as one of the great pioneers of antiseptic procedures, or the savior of mothers. Semmelweis supervised one of 2 clinics at a general hospital in Vienna. The mortality rates of infants and mothers due to puerperal fever in the first clinic was 3 times greater than those in the second clinic, and Semmelweis was dying to figure out why. He compared everything between the 2 hospitals he could. The only difference was that the first clinic was the medical clinic, and the second was run by midwives. In the first clinic, there were cadavers that were handled by students. Often medical students would go directly from handling cadavers to delivering children. Semmelweis began forcing everyone to wash their hands with a chlorine and lime solution before delivering. Mortality rates dropped to 1% almost instantly. However, his discovery was not accepted because he had no scientific explanation, and it was against the medical opinion of the time. Semmelweis lost his job in Vienna and moved to Budapest. He began at a hospital with the same issue, incredibly high mortality rates during childbirth. He repeated the process with the same results. Infant mortality rates dropped to almost 0. However, his practices were still not acknowledged or practiced. Semmelweis died in 1865 at the age of 47. His practices and discoveries were not implemented or believed until several years after his death.
Semmelweis' discovery led to the germ theory of disease and how we view cleanliness today. Semmelweis is important to public health because he is an example of using the public health approach to solve problems. Our steps in the public health approach are: number 1, pinpoint the problem. Number 2, figure out key risk and protective factors. 3, test all possible solutions. And 4, implement proven programs. First, Semmelweis noticed that the mortality rates in the second clinic were marginally smaller than the first. Second, he did all he could to identify all differences between the 2 clinics. The noticeable difference he found was that the first clinic had cadavers that were handled by medical students just before deliveries. Third, he tested all possible solutions and found that when medical students were required to wash their hands with the chlorine and lime solution before delivering, the mortality rate declined dramatically. Fourth, he required all doctors to wash their hands before delivering. When he did this, the mortality rate dropped dramatically. Semmelweis is evidence of the public health approach and how the public health approach can be used to save lives and promote public health.